Jerry Mathers has been in the spotlight all his life. The former child star has also spent many years managing diabetes, and sometimes the pain that goes with it.
I would even describe it this way. If someone took a pin and stuck it in your foot, that's kind of what it feels like.
It's called diabetic nerve pain or diabetic peripheral neuropathy. The longer you have diabetes, the greater your risk of developing this condition.
Diabetic nerve pain is a pain that arises from damage to the nerves when a person has diabetes.
Controlling blood sugar is an excellent way to change the course of this problem. But even if you have good control over your blood glucose levels, you can certainly have severe nerve pain associated with diabetes.
This program is about managing diabetic nerve pain. With the help of medical experts and real patients, you'll learn what causes this pain and what you can do about it. Jerry Mathers is an American icon. His parents didn't seek to make him a child star. He was discovered in a department store. Then, after a few parts in commercials and movies, he went to an audition that would transform his life.
And I said, well, I really don't want to be here because I have a Cub Scout meeting. And they said, okay, you can leave. And so I went to the meeting. They called that night. They said I had a job as the Beaver in a new television series because they would rather have a little boy that wanted to go to the Cub Scout meeting than be an actor. So that's how I got the job for Leave It to Beaver.
The show ran from 1957 to 1963, but has had a long life in reruns around the world. Jerry is used to being recognized everywhere.
I think it's because I grew up in people's living room. And so when they see me, they'll either say, hi, Beaver, which doesn't offend me in the least, or hi, Jerry.
After going to high school and college, Jerry returned to the role as a grown-up in the 1980s with the new Leave It to Beaver. When that ended, he became a businessman. One of his ventures was a successful catering company.
So suddenly, I started putting on a lot of weight. I knew that I was laying around a lot. I didn't have the energy, but I thought it was the good life.
Jerry started having pains in his feet and legs, but he didn't realize they were connected to diabetes because he didn't know he had it.
They were kind of shooting pains, but honestly, I thought that was from just being overweight. And it did hurt, but I was the kind of person that just kind of went, oh, it'll go away.
But a family friend, a physician, insisted Jerry get a checkup. That's when he learned he had type 2 diabetes, and the doctor said his blood sugar levels were way out of control.
She said, if you don't do something about your diabetes, you will be dead in 3 to 5 years.
That was more than 10 years ago. Jerry learned how to manage his blood sugar levels with medication and a change in lifestyle. Right now, he's not experiencing diabetic nerve pain. For many people with diabetes, however, it's a daily part of coping with the disease. But as you'll see, help is available. It starts with communication, sharing how you feel with your healthcare team.
It's important to communicate all the symptoms you're experiencing so that when it does become unpleasant and it disrupts your ability to enjoy activities or to do your work or to sleep, something can be done.
Ted has had diabetes for 20 years. He knows about the importance of keeping his blood sugar levels under control.
Well, when I started out, I didn't manage my diabetes real well. And then I started to get real sick and decided I needed to take a little better care of it.
By the time the person says to themselves, oh, I have damage, I better change my lifestyle, it's too late. Look right up at the orange strip on the wall there.
Diabetes can cause a number of problems that creep up slowly. Diabetic nerve pain is one of the most common.
And it is due to an attack on the nerves, so that the nerves are actually dying.
Nerves carry pain signals throughout your body. They're very sensitive to high levels of blood sugar.
The sugar is actually eating at the proteins that are part of the nerve.
Nerve damage can lead to many different symptoms, ranging from numbness or lack of muscle control to tingling, burning, prickling, sharp pain, cramps, and extreme sensitivity to touch.
This is a problem which may not be really an issue for a very long time. It might be a simple tingling or numbness, but not a painful experience, and then suddenly become one that is distressing and painful.
The diabetic nerve pain came on about 5 or 6 years ago. It felt like, the pain felt like needles in my feet. And it started in my toes and went to my feet. It's now going up my legs.
Ted's experience is typical. Pain is often felt first in the feet and hands because they're farthest from the brain and spinal cord. Long nerve fibers are usually the first to be damaged by high blood sugar levels. And like many people with diabetic nerve pain, Ted suffers most at night.
I notice the pain at night more than I do during the day. When I'm laying down and trying to sleep, that's when I notice it most.
Your risk for diabetic nerve pain is higher if you have poor blood sugar control, have had diabetes a long time, have high blood pressure, smoke, or are tall. Some of these factors you can do something about. Talk to your healthcare professional about managing blood sugar and high blood pressure and getting help to quit smoking. If you already have pain from nerve damage, there are medicines, techniques, and some devices that can help provide relief. So with awareness and action, you can develop a plan to manage diabetic nerve pain. As we've heard, when Jerry Mathers first experienced nerve pain, he didn't even know he had diabetes. When his foot hurt, he tried to ignore it.
Especially at night, when I was laying down at night to go to sleep, I get these shooting pains, and I think, well, I must have just turned it wrong during the day.
It's not uncommon that a patient will not realize that they have diabetes and experience a burning or tingling pain in their feet. And this may be, in some cases, the first clue that a patient actually has diabetes.
And you may check a few other things to make sure that something else is not also in the mix. Then you can be fairly confident that the diabetes is causing the nerve pain.
For Donna, there was never a doubt about the connection. She has had diabetes since childhood, and the pain has been with her for a long time.
I've started feeling it around 20 years ago. I had a lot of numbness and tingling and achiness, a little bit of heaviness in my legs, and I had some trouble walking.
Just walk the length of the room.
Like any kind of pain, diabetic nerve pain cannot be measured directly with any test or machine, but you can describe your pain using a pain scale. For example, from 1 to 10.
My pain can range up to a 10, and it can affect my daily activities where I might not be able to do anything that day. I'm laid up on the couch.
I think the best way to approach the physician is to not only talk about the intensity of pain, but also the quality of it, what it feels like and what they're experiencing.
What are you doing for exercise?
And I think the opportunity to discuss how this is impacting your daily activities or your recreational activities is a crucial part of helping a physician understand what you're going through.
Do you feel any buzzing there at all?
In addition to checking your blood sugar level, a healthcare professional can diagnose your pain by considering whether there might be other causes, and by testing your reflexes and sensitivity to touch. You might also be referred to a neurologist for electronic tests of nerve function.
I think when a patient has nerve pain associated with diabetes, the first thing we try to explain to them is that oftentimes our goal is to reduce their pain intensity, not simply to take it all away.
It's perfectly normal to want your pain to be reduced as much as possible, but thinking about what you want to be able to do can help you set realistic goals.
My goals are to just be able to get up in the morning and live pretty much a normal lifestyle.
For Donna, that means finding a way to dampen a painful array of distracting sensations.
I feel a lot of burning and tingling, and it feels like bugs are actually crawling on your feet. When I go in for a doctor visit, I try to explain what I would like to do and what I would like to get out of my visit, and maybe things that he can help me with to achieve that.
Defining goals can start the process of finding the best treatment. For example, patients might need help getting sleep or handling their mental health.
Maybe they're no longer sleeping. Well, you may be able to manage pain pretty well if you've got a good night's sleep.
Ted identifies his objective very simply.
The goals in my treatment are to stop it from progressing any farther. I know I can't get the nerve damage that I've done back, get that stuff back, but I'm trying to, through medication and exercise and my diet, I'm trying to stop it from going further.
The first step in managing diabetic nerve pain is to get your blood sugar levels under control. This can prevent further damage and possibly even reduce the pain. Talk with your healthcare professional about how eating a healthy diet, exercising, checking your blood sugar, and taking your medication can help.
I was very careful with my meds because suddenly I realized how much I had to lose. And so I immediately started on the meds, and we also started me on a diet and exercise regime.
Even if you test your blood sugar often at home, you also need to get a regular checkup with an A1C test. That's the test that tells you how the sugar levels have been over time.
If the A1C is running high, that tells you although the sugar today may look fine, the sugar over the last couple of months has been very high.
For Jerry Mathers, a key part of getting his blood sugar under control was learning how his attitude toward food had put him at risk.
They say I looked around me, there were a lot of people that were my weight. I had no idea about diabetes. I had heard about it. I thought it was from eating too much candy and sugar, and that's how you got it. And that is how naive I was at that time. I didn't even realize that weight was a factor for it.
So in addition to controlling his blood sugar with medication, Jerry also started taking control of what and how much he eats.
Portion control is one of the things that I really have to watch, especially at restaurants, because restaurants, they typically give you, because you're paying for it, a lot more that you can eat. And a lot of times people think, well, if it's there, I'm going to eat it. Well, I've now found out it's much better to take it home and have sometimes 2 and even 3 meals in the course of a week, and that is much more of a proper size portion to eat.
For many years now, Jerry has made healthy food choices and regular exercise key to his everyday life. He's fit and his blood sugar is under control, but he still checks it regularly. And he gets an A1C test at the doctor's office regularly to make sure he stays on course.
My doctor now, we communicate very well. Sometimes my blood sugars have gone up, and we say, well, what are you doing differently? And it's usually that I've been working someplace, I've been out of town, I've been cheating a little bit, because, you do that. You think, oh, I did this, and nothing happened. But it always shows up in the end, and we talk about it, and I make changes again and become remotivated. So that's why it's good to see him every 6 months, and it's a barometer of where I am and how I'm doing.
For Donna, controlling blood sugar levels is more of a struggle, despite checking them regularly and taking medication.
I am considered what they call a brittle diabetic, so sometimes no matter what I do, I could be high one day, low the next day. So it's been pretty difficult.
Through the years, diabetic nerve pain has developed in her feet, legs, and hands. For Donna, an ongoing pain management plan is the key to moving forward with her life.
Getting help for the pain, there are very many different things you can do for that. I just think you have to be very open with your doctor.
Many types of medicines may help relieve diabetic nerve pain. They come in different forms: pills, patches, injections, and creams. It might take time to find the treatment that works best for you.
There are multiple different types of medications for diabetic nerve pain. They work by different mechanisms, and much of the work of a physician and a patient together is to sort out what the best combination might be or whether one medication will suffice.
As Ted discovered, it can be a step-by-step process. Other medical conditions and treatments must be taken into consideration. Ted also keeps his doctor informed about changes in the pain and how the medication is working.
And I let him know what level of pain I'm having and whether I think that I should get a little more pain medicine or whether I should have it on a different schedule. I work with my doctor, and he's real good about working with me on that.
The goal is to find medicines that work for you without causing side effects that you cannot tolerate. Sometimes a side effect, such as drowsiness, can be timed to your advantage.
For example, if a medication makes you sleepy, you might want to take it at night.
Oftentimes, the relationship with the physician is one of trying to find the right combination to minimize side effects and maximize relief.
It's important to understand that 100% pain relief is usually not possible no matter what treatment is tried. Yet studies show that people report real improvements in mood, activity, work, sleep, and enjoyment from life, even when pain just comes down a few notches on a 10-point scale.
And the medications we use, we expect them to get down 3 points. So if they're at an 8, they can get down to a 5, maybe a 4.
I have to tolerate a certain amount of pain most of the time.
While working with their healthcare team to manage pain, patients also need to keep the ultimate goal in mind.
To improve the diabetes, to improve their lifestyle, to do other things for themselves. And that will, in the long term, do more for the pain than the medications that I'm using.
You might also talk with your healthcare professional about non-medicine pain treatments. Devices and techniques that you might consider include electric nerve stimulators, cold water treatments, or a bed cradle to keep sheets and blankets from touching sensitive feet and legs. Physical therapy can be very useful, especially if it helps you get up and around.
Physical therapy is part of the beginning of a fitness program. I, of course, explain to the patients that this is not a 6-week program. This is a 60-year program, but they're just starting with the 6 weeks in physical therapy.
Being active can not only help you feel better, it can also help you control your blood sugar levels.
I get up every day. I run. It's about 5 miles. I walk a lot of it, and I monitor my heart rate, and I find that helps control my blood sugar.
Just as exercise is very important for diabetes itself, exercise is also very important for pain management.
You don't need to invest in a health club membership or expensive equipment, but you do need to invest in your health by doing what you can to be active. Before starting any exercise program, though, talk to your healthcare professional.
My exercise isn't as much as I'd like to because I'm having problems walking. My stability isn't real good. But I do take my dog out for a walk. I do walk a 1/4 mile down the street to my mailbox and get my mail on that. I try to walk quite frequently.
The term alternative and complementary is used to describe other treatments that many people have tried for relieving chronic conditions such as pain. They don't require a prescription, and they might not have been scientifically studied. Your healthcare team needs to know if you plan to try them.
Approaches which maybe historically were considered complementary are now part of the mainstream of care for many patients. And that might be the role of acupuncture or the role of other techniques which are not necessarily pills, but are a central part of the ways that we combine therapies to help folks get relief.
Again, always tell your healthcare professional about any alternative or complementary therapies you may be using. Nowadays, Jerry Mathers loves to be on his feet. But when his diabetes was first diagnosed, he was in pain, and his blood sugar was alarmingly high.
Now, in the very beginning, when I was running the 7 to 850 in my blood sugars, my feet were hurting quite a bit. And they told me that it wasn't going to go away.
But as his weight and his blood sugar came down, Jerry was able to get back on his feet, literally.
So that took me about 6 months before the really severe foot pain went away, and it got gradually less.
Jerry continues to take extra care with his feet. He knows that people with diabetes might have nerve damage that would make them unaware of dangerous infections. At worst, foot problems related to diabetes can require amputation. That's why it's important to check your feet at home and at the doctor's office.
That's one of the things my doctor does. He looks at my feet. One of the other things that people may not know about diabetes is it also affects your healing process. So if you get like a scratch or anything like that, it takes longer to heal.
In diabetes, the immune system, the system that fights off infections, doesn't work as well as in people who do not have diabetes. So not only may you not feel the ulcer develop, you may in addition wind up not be able to fight off the infection that occurs because you got that ulcer.
I check my feet all the time. I'm very cognizant about my feet. I have some problems with my toenails and that, and I'm real careful about cutting my toenails, and if I get a cut on my toes or anything, I'm real aggressive about taking care of that so that I don't lose my feet.
Here are the basics of the foot care you need to do on a regular basis. Clean your feet daily using warm, not hot water and mild soap. Don't soak your feet, just wash them and use a soft towel to dry them off. Check your feet and toes every day for cuts, blisters, redness, or other problems.
You need to look at the nails to see if they're developing unusual ridges or growing funny. And then lastly, you want to check to make sure you can feel things in your feet. And if you can't, you may want to see a doctor to help explain and diagnose why the feeling in your feet is not working.
My mom, through the years, has helped me a lot with checking my feet. My daughter helps me once in a while, but growing up, it's always been my mother.
Donna's lucky to have help at home. Some of the places you need to check are difficult to see on your own.
You need to have someone else look under your feet because it's very hard, or look in a mirror to look under your feet.
Keep toenails trimmed and files smooth. Wear shoes or slippers indoors to protect your feet from injury. And wear shoes that fit well and let your toes move. Break in new shoes slowly and carefully.
It's important to make sure that a patient with diabetes has correctly fitting shoes because they're at risk for not only having ulcers, which could be related to undue pressure, but also other infections, either of the nail or from a cut that they might not otherwise feel when it happens because their sensation is reduced in their feet. Oftentimes patients with chronic pain feel a sense of isolation because it may not be apparent to the people in their life what they're going through.
Love you.
The family needs to understand what the person can and cannot do. They should not help when the person is able to do something, so they don't enable the person lying flat or sitting around instead of going to walk.
I always got to count when I go.
The support of friends and family has kept Donna going for decades.
My family gives me a great amount of support. I do also have a close-knit group of friends that give me support also. I think that's what has helped me get through it. I think sometimes when you get really down and they look at things a different way, that really helps you.
Ted and his wife are a team. She's there for him in many ways, including helping to choose the right food.
Well, if it wasn't for my wife, I probably wouldn't make a lot of healthy food choices.
In addition to asking family and friends for help, or if you're on your own, talk to your healthcare professional about what support services might be available in your area. Connecting to others can make a big difference. Be sure to find a support group with a strong, positive, and uplifting tone.
It's important, I think, to make sure that patients who have chronic pain have an outlet to discuss what they're going through, either with family or with friends or with patients who are experiencing a similar set of symptoms.
Jerry Mathers still has a lot in common with the beaver. He has a positive approach to life. He and his wife can look toward the future knowing his blood sugar is under control.
But when somebody tells you, and you believe them, that you have 3 years to live, or you can make changes, I think most people would do what I did and make changes.
For Donna, the challenges are more difficult. As we've heard, her diabetes has been very difficult to control. She monitors her blood sugar closely.
It's become second nature because it's part of my life now, and I wake up in the morning and it's my daily routine.
Okay, we'll take your blood pressure.
Okay.
Regular checkups are also part of the routine, not only with the doctor who helps manage her diabetes, but also with an eye doctor, a foot doctor, and a pain management specialist.
I think it's also important to make patients aware that there's going to be an ongoing assessment and an ongoing dialogue.
So I try to have them keep the overall picture in mind and to just set limited, reasonable goals and take it one day at a time.
Ted is a veteran. He served during the Vietnam era. When he started to experience diabetic nerve pain, he thought he could just tough his way through.
At first, I didn't worry so much about the pain as the disease. As the pain came on, I lived with my toes being a little numb and feeling funny and trying to take care of my diabetes. But now I work pretty hard at the pain.
If you are diabetic and you're experiencing shooting, burning type pain, especially in your feet and hands, you need to find out what might be causing it. Ask questions and insist on getting answers you understand. If you are not finding help through your regular medical care, then a neurologist may be able to help you improve your condition. Finding the best treatment for you may take some trial and error, but as you've seen in this program, you can find relief for diabetic nerve pain.